This is the Art Beauty Podcast, where we are always reaching for truth in beauty. Remember, the brands on the show are not paying to be here, so we get to ask the questions you want answered because you deserve to be informed so you can make the best choices for yourself. And with that said, I'm Amber, and today my fabulous co-host is Dr. Macrene Alexiades. I hope I got that right. She is a fabulous Greece native. By the way, Greece is one of my favorite places in the world, but a Greek name, so I'm hoping I'm pronouncing that right. She is also holds 3 degrees from Harvard, is a practicing dermatologist in New York City, and an all-around amazing, brilliant woman. I'm so honored to have you on the show today, Dr. Macrene. How did I do with the pronunciation?
Like a native, like fellow Greek. I'm so honored.
I mean, so, I have, prior to this, when we were just chatting a minute ago, Greece is one of my favorite places in the world. I've been there 3 times now, never to Skiros where you are, but it is just magical. You were actually born in Greece?
I wasn't born in Greece,
Okay.
but I'm a dual citizen. I spent half my life here, half my life in America, back and forth. And so that has really inspired me and given me a worldly view and a balanced view. And the Greeks, we were taught the Socratic method from birth, which is to question and to probe and to find the meaning of life. So it has really benefited me as a physician and a scientist and a creative and an artist. And I'm grateful to be able to bring that kind of global viewpoint to everyone.
I love that. And again, I find that the Greeks, of all the places that I've been, were the most familial, the most warming, the most, come on into my house, come do this. And also the best tomatoes I've ever had in my entire life. Like,
Yes.
just the best food ever.
Thank you. Well, it's sun, and believe it or not that much water in the summer,
Yeah.
and soil makes for fantastic fruits and vegetables.
So delicious. Listen, full disclosure, we are recording this. It is still summer, but this will air in September. So with that said, I'm so excited to have you here because you are truly an expert in everything lasers. In fact, you told me you were writing a second textbook while you're there in Greece.
Yes, I usually take this time when I'm not seeing patients to work on my academics, which is particularly textbook writing, which requires undivided attention. My first textbook is Alexiades' Cosmetic Dermatologic Surgery. That was published by Wolters Kluwer. You can get it on Amazon. And it is the first of its kind. It's a disorder-based text that takes the reader down an algorithm of the best medical, cosmetic, which includes injectables, peels, and lasers, and surgical treatment options. And it's good for both patients as well as colleagues, dermatologists, plastic surgeons, physicians who really need to know what the gamut is, the panoply of treatment options that are available. And then my second textbook is on photodynamic therapy. That is with the publisher Elsevier. That is the book that I'm finishing right as we speak. And that is an area of specialty of mine as well. In addition to lasers, it's the use of light to cure disease.
Oh, I love that. We've been talking so much about, different light therapies, red light therapy, blue light therapy. I'm hoping that today, that you are really known as a laser expert. And since, by the time this airs, last weekend will have been the unofficial start to or end of summer, even though summer doesn't end for like another few weeks. This is a really great time for people to start thinking about different sort of laser therapies that they can do, right? And so I'm just wondering, when we hit the fall, what are some of the most popular things that you are seeing in your offices?
Great questions. And you are right. My patients are planned out months in advance. So I do my fall laser planning in the spring. So patients
Okay.
come in the spring, they start to complain about the things that start to present themselves when we start to get sun exposure, such as brown spots, melasma, hyperpigmentation. And those are not conditions you want to treat in the summer, particularly with lasers, because lasers kick up the heat in the skin and you can get a tanning like result from that. So we pause on the use of lasers for pigment until the fall. So that starts back up pretty much end of September, beginning of October. And the other is that lasers against pigment are not as effective in the summer when you're getting all your sun exposure. So it
Right.
may actually be working, but it looks to the patient as if it's not working because they're tanning in the summer.
Yeah.
So all my laser cases are already fully booked all the way through to the holidays.
I mean, yes. And you do have, I don't know, are we allowed to name drop? Can you tell any of the celebrities?
Well, I think it's like public knowledge. I leave it to my celebrities. If my celebrities want to mention me and give me some love, and some of them do, like Sienna Miller, Brooke Shields, and
Yeah.
those guys, it's wonderful. Nikki Hilton. But I really adhere very, very, very strictly to HIPAA.
Of
And
course.
I know, like, I mean, people have called me a billion-dollar box office success, which I cherish that title. But my lips are sealed, and but I derive a great deal of satisfaction, pride, and joy at keeping actors and models in their business, in their work, well until, their elder years, which is really a source of pride for me.
So, I mean, on that, do you feel like there are certain things that you recommend kind of everybody does? Of course, we all have different skin types, we all have different conditions, but are there certain procedures now that you are loving, especially coming into the fall? Clearly, we are too late to book with you. Sad, sad. But are there things that are kind of loving out there for people to be doing this time of year? And are there certain treatments that you love for this time
Oh,
of year?
yeah. There is no end to what I can do. I mean, I have to say, I was at a dinner party that night, and one of the ladies was saying how plastic surgeons or dermatologists told her there was like nothing to be done for her. I have to say, I mean, I am fortunate that I have the embarrassment of the riches of knowledge and experience in both injectables and devices, but really there's no end to what I can do. I can treat in the summer. I'm just saying that there are certain devices you don't want to do in the summer, such as fractionated devices, Q-switch devices, picosecond technologies. Those are better done in the fall.
Right.
But I have great treats for everyone all summer long. One of my current favorites is radiofrequency microneedling, which I am, honored and acknowledged as single-handedly the dermatologist, scientist, and laser specialist who brought this whole genre to market. I sought and attained the FDA approval between 2006 and 2010 for the prototype radiofrequency microneedling device. That one was called the Profound. And since then, we've had a huge crop, a whole generation of devices, such as Morpheus is one that people know about. But there are many different types of Genius, Infinity, Intensive. They are utilized in a way that is safe for all skin colors, all
Right.
skin types, and can be used in the summer months. So that is one of my all-time favorites for skin tightening, wrinkle reduction, rejuvenation, all summer long with no risk of downtime or hyperpigmentation.
Okay, but so let's go back to the fall now, right? So because that's what we're kind of the season we're coming into. Good to know though that radio frequency can be done year round. What are your fall specific treatments? Like, what are the things that you're starting to address now?
Okay, so come September, you're done with your summer, Labor Day is over. Now we're in the saddle. We're looking at this rung of treatment that is really dedicated to this time of year. When you're in September, be aware that there's still this delayed, what we call seasonal lag. You can get this first week in October that's very sunny and warm, and
Yeah.
it really tempts you to be outside. So please, but delay a little bit in treating your brown spots and hyperpigmentation with devices until October. However, in September, I do start to do some rejuvenation on people who I trust and know are really not going to go out in the sun. So that might include intense pulse light, like IPL. That is great for getting the summer off. All the sun damage you've accrued over the summer, you can start treating in September. And if you're somebody who really is not going to go out in the sun, whether it's because you have kids in school or you yourself are working, and you know that even if it's an Indian summer, you won't be outside, then you can treat with rejuvenation lasers, such as fractionated resurfacing, known as Fraxel, picosecond lasers, such as Picogenesis, or its predecessor, Genesis laser. These are all devices that are great for rejuvenation, for getting rid of sun damage, which you've accrued over the summer in short order, so that especially if you can do a trio, which a lot of times these devices are done 3 months in a row, a month
Yeah.
apart, 3 treatments. If you do September, October, November, you're ready for holidays. You're ready for Thanksgiving and winter holidays.
Now, I have to ask you, and I don't want to put you on the spot because do you have a lot of these devices in your office?
Oh yeah, I have over 50 lasers and devices in my office.
So here's where I'm going to put you on the spot then. Is there one that's like kind of your favorite?
It's like asking who's your favorite child.
Oh no.
No, I mean, my girls will tell you, like they're all my favorites. For
Okay.
example, I have specific devices that are my go-to and my favorite for eyelid tightening. So my claim to fame is that I replaced plastic surgery with devices and injectables, right?
Yeah.
And I'm replacing cosmetic procedures with active ingredients through my Macrene Actives. So that's been kind of the progression of my career over the last, and I have to say, I've been in science for over 40 years. So I've been working really hard for many decades. But the progression was initially replacing plastic surgery with devices and injectables. And I go through phases of what my favorites are, and then taking all that knowledge and translating it into active ingredients. So ultimately, we can do all this at home. But I will just give you some of my highlights.
Yeah.
Okay. All right. So if you don't want plastic surgery, be on the lookout for skin laxity. In
Yeah.
my opinion, other than like having brown spots and sun damage, which of course does, make you look not so great, I think it is equally important to keep an eye out for jowls and loss of the beautiful like elasticity of the skin that you want, especially in the jawline and neck. If you start to see jowls, if you start to see laxity, intervene earlier with non-surgical alternatives so that you don't end up needing surgery. Give you an example. I've been taking care of a classmate of mine from Harvard undergrad that we were class of like 89, and she doesn't look any different than when we were in college. Why? I have her face memorized, and she believes in me so much and in the science and what I've done. She comes every 4 months like clockwork for all these years, 20 years, getting skin tightening with me with radiofrequency devices, infrared light. She doesn't have any jowls. Of course, I
Yeah.
puncture with a little bit of filler, and then she uses my actives. So if you were to really prioritize devices in my practice, I would say you want to keep on top of 2 classes of devices. One are the skin tightening technologies, whether it's around the eyes, jawline, or neck, or body, if you're down to body now. And then the rejuvenation technologies that we just talked about, IPL, fractionated technologies, Genesis type devices, to keep the sun damage and wrinkles at bay. And then if you need something more aggressive, you can always go to a CO2 laser, which I'm a specialist in that as well. And that really is, in my hands, an art form. I tailor the carbon dioxide and the erbium lasers, which are really our Cadillac devices, for those who have more significant sun damage in most cases, or wrinkles and aging. But honestly, even people who have very light skin that starts to wrinkle a little bit prematurely in their 40s may be candidates already. And that too prevents the need for, say, blepharoplasty, which is eyelid surgery. It may prevent the need for a facelift because it'll give you enough of a strong rejuvenation.
Okay. By the way, you blow me away. I want to point out again, you've got 3 Harvard degrees. So one smart cookie. I know you mentioned, you kind of blew over that, but I just want to, for our listeners, how brilliant you are. I mean, I work with the editors at New Beauty and they all sing your praises. I know that they just say that you are just a wealth of knowledge. So I do appreciate your time today. In terms of some of these skin tightening devices, are you talking about things like Althera? Are there brand names that you kind of like or maybe don't
Yes.
like?
Yes, yes. I am a huge fan of radio frequency and infrared light.
Okay.
I have dedicated over 2 decades to figuring out how skin tightening works. I'm known particularly for my prowess with radio frequency technologies and having defined for the industry how radio frequency heating works in the skin, both from a mathematical perspective as well as a biological perspective.
Mm-hmm.
And I've worked out the ideal treatment parameters to guarantee success,
Wow.
maintain excellent elasticity and resilience of the skin through the upregulation of collagen and elastin and hyaluronic acid without charring the tissue. And this is something I want your viewer to understand. If the device is too strong, too hot, too much energy, it can burn the target and actually ultimately make your skin laxity and wrinkles worse.
Right.
That's why it's so important. My textbook, my work, my published papers, which I encourage my colleagues who are dipping their toe into tightening technologies to avail themselves of, is that less in lasers is sometimes more. As a
Yeah.
matter of fact, go as far as to say is less is usually more. In that with our technologies, we used to think we needed to get hotter, stronger, higher energies. It turns out that it's like the old tale of the north wind versus the sun. The north wind and the sun had a battle, and they were looking to see who amongst the two could get the man to coat off of his shoulders. And the north wind blew and blew and blew, and the more he blew, the more he held on to his coat. Then the sun said, step aside, and he warmed the man, and he just took his coat off. This
Yeah.
is what I do with skin. I coax the skin to doing what I want it to do. I nurse the skin and cultivate those cells to churn out collagen, elastin, hyaluronic acid, and rejuvenate themselves. I don't force it. I don't burn it. I don't harm it. So I have a completely different philosophy and approach. I'm like the sun, warming the skin to the point where it then upregulates formation of all these key ingredients, and I get wrinkle reduction, laxity reduction, removal of brown spots, removal of redness through this more gentle approach. So with skin tightening, where I think some of your viewers may be like, you know what, I had this done and I don't think I look better, or I looked better, but then after a year, I felt like I looked worse. It's the parameters. Very important that the correct device be used. And again, I favor very strongly the radio frequency technologies. And in some, there are a couple of companies that make infrared devices. So in terms of RF, any and all of them work extremely well as long as you're monitoring temperature. So whether you're using Candela's devices, which is like, for example, the RF microneedling, or whether you're using skin surface technologies, I happen to love the luminous technologies, which are called New Era. Or you're using like a triactive, which is a tripolar technology there as well. Or whether you're using infrared light, for example, Cyton has one that is called Skin Tight, and Alma has one that's called NIR. It doesn't really matter. What matters is that the laser specialist is monitoring the skin temperatures to get exactly to the temps that my papers have defined and not exceeding those levels so that we get maximum outcome. Ultrasound, you touched on ultrasound technologies. They initially were using too high a temp, and they've pulled back. It was extraordinarily painful, as you may know or may have heard. So they've pulled back on those parameters. And there is a company who I'm very close with that is called Softwave, a Shimon Eckhouse, old friend of mine. I've worked with him for over 2.5 decades. And we may be partnering so that I can start to apply some of my science to their technology, which is ultrasound, to get it to the level of the RF with respect to temperature control. But there is potential for every set of wavelengths to give us the results we're looking for, as long as we know what our clinical endpoints are in terms of temperature.
Please get with Softwave. I went and was burned by that device. So yeah, but and on that note, I want to just point something up, because you're bringing up such a good point, and I wonder if you have any advice here, because so much of this is not necessarily the device, but the provider, the person who's using it. It is an art form. They have to know the right way to do it. I do not blame Softwave for my burn. I blame the person who did it, who clearly just wasn't either paying attention, or we're not even going to go there. Do you have advice for people, though, on how to find a provider that maybe is following those parameters?
Yes. There are two sets of very important criteria and factors. Okay. One is certainly the person who's using the technology being adequately trained and so forth, and having read all my papers and having my brain, right? That's like one option. But the other, and I think much more realistic and practical and important aspect, is the device manufacturer creating protocols that are fail-proof.
Yeah.
So what I've done when I've partnered with these teams, with these companies, and some of these companies have done this so well, and I'm not taking full credit. I don't think I'm, the only one who has these great ideas. I love my colleagues. They're amazing. And ideas happen at the interface between people. Like we're all a family, and we create ideas when we talk to each other.
Yeah.
But what I partner personally and what I'm known as is a protocol developer by these device companies. They come to me in the early stages. Not that I'm bored with sort of like later stage studies, but it is kind of boring if we've already worked out the science. So I tend to really be interested and engaged in figuring out what is the optimal protocol for technology. So they come to me with their device, and I figure out how to use it maximally optimally.
Right.
So once we've done that, we then program the technology. And so some of these companies have done a great job at pre-populating the energy level, which is called the fluence, the pulse duration, which is the width of the duration of the pulse that's administered, the pulse diameter of the handpiece. So it's called the spot size, and the repetition rate, and even as so far as to give you counts of pulses and cumulative energy that you've delivered to the tissue, so you give enough, so you don't have like a lazy person who kind of tries to cheat. So we're ensuring a couple things for you: A, that you don't get burned, and B, that you actually get a result, you get an outcome. This is where partnering with somebody like myself is very important, because when I create my protocols, I put a cap on that energy level, the number of passes or pulses delivered, the stacking of the pulses, all kinds of little nuances to prevent excessive. And my strong bias and preference is real-time temperature feedback, which is what I helped pioneer in the industry. I wrote a very important paper in the early 2000s, looking at skin surface temperatures. And I have a PhD in genetics, but it was in the Department of Neuroscience as well. So I'm a specialist in nerve endings, the nervous system. And I outlined and detailed the pain threshold for the nerve cells in our skin and defined when they fire. So you put your hand on the stove and you feel pain. And it's 42 degrees centigrade where the first set of those pain sensors will trigger and say, it's hot, take your hand off, right? It's the same with a laser. It hurts because you've gotten too hot. And the reason that temperature threshold is so important is this: if you exceed that temperature, you're actually causing harm to the tissue. Therefore, it's important that they build into the system some sort of real-time temperature feedback. And if in the absence of that, use other measures to approximate, or what we do through what's called Monte Carlo simulations, mathematical modeling of what the temperature is based on what we've delivered. My preference is real-time feedback. I will accept certain other proxies for it, but no matter what, when they finally create protocols so that any doctor who turns on the device and presses a button sees pre-populated the energy level, so that they don't have an opportunity to do what happened to you, irrespective of whether or not they're in my category of expertise.
So you are giving us so much incredible science here. You know, I've got listeners all over the world. What are we supposed to do? And how do we go into our doctor and say, hey, is there a protocol for this that you're following? Is there a place that we can know as, consumers, if devices are following protocols? Like, how can we, for those of us who are not lucky enough to be in New York, and it seems like you've got a long waiting list, so that's going to be probably most of us who can't get in to see you. What advice do you have in terms of us protecting ourselves or going in or making a best investment in some of these procedures?
I think there are two pieces of advice I would give. One is knowledge is power. So of course you can get my textbook. I'm not plugging my book, believe me, but you could. I mean, I have had patients and customers, clients who like went to Amazon, bought my textbook, and they felt like so comforted by it because they could go into their dermatologist related specialist and say, hey, look, what about this laser? which is
Right.
first line. Why are you offering me that laser, which is second line or third line? Can you please explain? Sometimes it's because they don't have the first line device. They're giving you what they have in their practice. For some people who live so far away from another laser specialist, they might be willing to take a second level laser with somebody they trust rather than drive 50 miles. I get that, but at least be armed with knowledge and information. So
On that, well, can you share some of the first line lasers with us?
yes,
Is this, and by
yes,
first
I'll
line,
give
does
you
this mean, is this like top of the line when you say first line?
first, yeah, top of the line. So for example, like, if you have a single brown spot that you want removed, and it's, there's a big disparity between the brown spot and the skin. The first line devices are Q switched or picosecond lasers. It's not to do IPL on that thing, okay? But a lot of doctors don't have Q switch lasers, and the picosecond technology is the most expensive technology in the world. You have to be practicing at my level to make it worth having it in your practice at all. I must have the best lasers. It's my identity. It's who I am. But for a lot of doctors, it just isn't. So they just have a few small number of devices. So if you have a single brown spot, do you really want to get an IPL 5 times when you can go and with Macrene get one treatment and it's done forever? You know what I'm saying? So there's first line devices and then there's second line devices. And that's where sometimes they can't get access to the first line device. They may settle for a second option device, but at least you're informed and you're making an informed decision.
So tell me again, what is the textbook that has this information? Because I'm just letting
Oh,
people know that clearly there is so much to know. We tried to condense it a little bit into this podcast. I would love to have you back again because you know so much about this. But if we want to arm ourselves with more information, especially going into laser season, what was the textbook again?
it's got my name. It's Alexiades, Alexiades, and it's called Cosmetic Dermatologic Surgery. And you can find it on Amazon or Wolters Kluwer. And what I like about what I did and what I envisioned, which was first in the business, is it is the first algorithm-based textbook that is disorder-based. It's not like there's a chapter on fillers, there's a chapter on lasers, and that means you already have to know what you're supposed to be treating with, right? This takes that out of it. It starts with the disease, whether it's hyperpigmentation, whether it's redness and broken capillaries, whether it's wrinkles, whether it's skin laxity, whether it's cellulite, and it takes you down a decision tree of the medical, cosmetic, and surgical treatment options. Why is this important? I'll give you melasma as a classic example. People with melasma should not be treated with lasers alone. They just shouldn't. They should be treated with medical therapy, which is topical therapy, prevention, which is sunscreen, sun avoidance, etc. Sometimes we even give a medicine by mouth, tranexamic acid, to get rid of melasma. Then you can complement that with chemical peels and a very short list of devices, because it's been proven that other devices actually make melasma ultimately worse. I'm arming my people with info. Get the proper treatments in place, get the medical and the cosmetic treatment. And if you have skin laxity, know what your surgical treatment options are. Or if you're presenting with a growth, a tumor, maybe it's benign. Let's say lipoma, for example. You would want to know what the proper treatment protocol is. Is it to excise it, or is it to do cryolipolysis, which is what some people are doing? And the answers are there, both for your safety and your best health, and to be treated at the absolute best standard of care, and also so that you're familiar with the proper decision tree so that you make an informed decision with your physician. So I think having information so that you're armed with that going into it is one really good way to handle it. And the other is seek out a very credentialed, highly respected laser surgeon. My colleagues who are top in our field all bring different areas of expertise. We've all contributed to different segments of our field and our specialty, and we learn from each other. Right. These people are top. So if you're in the top hands, you're going to get really good care, and they're going to have enough devices in their office to offer you the right first line laser.
I like that you pointed that out too. Be wary if somebody's pushing one device for a lot of things or they only have one device. I think that that's a really easy place to start. How many devices do you have? Because then you know that they're not just trying to sell you on the one. Dr. Macrene, we are running out of time here, and I want to be conscious of this. I will make sure to put the book link in the show notes. So if you're interested, um,
Yes.
you're joining us today from Skiros in Greece, and I'm just wondering if quickly you could highlight. You created a beautiful line of products. One of them was a New Beauty Award winner. Can you just give us a sort of overview of why you created these products? Because I know that they're very, very clean, but yet effective. And you've mentioned they were designed to replace some. I'll let you take it away.
Yes, I mean, my friends have all joked that I need to leave my brain to the Smithsonian, because it's got a lot of stuff in there. So what I did was I translated procedures into active ingredients and isolated them from plants and wrote patents for my work on coordinating 50 active ingredients per jar, per bottle, to recapitulate the results I achieve with rejuvenation lasers. I'll give you an example. Peptides, hyaluronic acids, instead of, say, a rejuvenation technology that upregulates collagen and elastin, okay? Amino acids, amino acid derivatives, instead of a Q switch or picosecond laser to gently remove brown spots over time. Redness reducers, which are plant-derived agents that reduce redness, instead of, say, a V-beam or an XLV laser, which I would use to get rid of them in the office. And that logic, which started with my skin aging classification scheme, which has been published and validated and used by in clinical trials for the last 15 to 20 years or so. It's the division of skin aging into different aging categories, because not all of us age in different categories at the same rate. Some people have very tight skin, but they have a lot of wrinkles. Others have very loose skin, but it's smooth as a baby's bottom. So it just shows that everyone's different. So what I did was I coordinated my ingredients to cover every single category of skin aging, so that I'm addressing wrinkles, laxity, brown spots, redness, pores, solar elastosis, dullness, all the issues, and housekeeping actives, antioxidants, and repairing agents. You've heard of DNA repair. They come from plants from land and sea. And high-powered antioxidants like superoxide dismutase, resveratrol, which I call that the housekeepers of the cell. They clean up damage and they actually increase the lifespan of the cell. And barrier repair, because so much of redness and flaking and inflammation is due to an upset skin barrier. Right. And having good barrier repair also rebalances the microbiome, so that you can't overestimate the impact of inflammaging, which is due to a disrupted microbiome. So I've looked at it from a 360 approach, and Macrene Actives is really like more than a multivitamin. It's like the full diet for your skin to ensure 100% skin health and to restore the skin back to the way it was when it was 25, before it started to degenerate. And what I did was, and this is my mission, is they're in glass bottles with wood lids, elimination of plastics, uncoated paperboard with vegetable inks, and even the wafer seals are plant-based, compostable. And that's it. I mean, I am trying, you have to unlock it, but I am trying to help the earth while helping your skin. And that's my mission. And that's what started me in science 40 years ago, was finding non-toxic alternatives to pesticides, plant-based alternatives to pesticides. So I have a very long and storied history in science, looking to help and heal the earth.
I love that. I love that. I love that. And, for everybody listening, if you're interested in purchasing these products, I know they're available at Neiman Marcus, some of them, also at Macrene Actives, right?
So this collection, which is the Skin and Earth collection, has been exclusive at Sephora.
At Sephora.
On my website, yes.
And then don't you have, isn't some of your products are also sold at Neiman Marcus, no?
Essentials collection, which is the full line, the full original, is at Neiman Marcus, Nordstrom, Saks. We have really nice distribution. Net-a-Porter's. We have really great partners who love us, and we love them so much. And we are so grateful for their support, because they're helping your skin and the earth.
Yes. And, I have to say, it is such an honor to have you on today. It's clear that you are beyond brilliant, that you are certainly, like I said, just a fountain of knowledge. If
Thank
people are
you.
interested in learning more about you, maybe if they're in New York and they want to try to get an appointment, where should they go?
Well, they should use your name because it's my and if they say that Amber sent them, maybe they can get in through the front door. But it's Dr. Macrene Alexiades. My Manhattan office is on Park Avenue. I have a Hamptons office as well. And I'm the only that I know of dual certified in the EU and the US. I am also certified here in medicine, surgery, and dermatology in Greece. Here so far, I've been doing mostly pro bono work, but I have a faculty appointment both in Europe and in the United States, and that also gives me broad view access to technologies as they launch worldwide that I can then bring back to the United States as well.
And I'm just going to give New Beauty a little bit of plug because I work with them, that I know that you are often quoted in articles with them. So, if you Google her name, you will also see those pop up. Check them out. I want to thank you so much for joining us today. I really, really appreciate it.
Thank you, New Beauty. I've been with you since the very beginning, and I love what you're doing. And it is a fountain of knowledge for everyone.
They are. I'll make sure to share that with them. And you know what? If you have questions you want me to pass on to Dr. Macrene, I can do that. You can email me at hello@artbeautypodcast.com. You can find us on Facebook, Instagram, and YouTube at Art Beauty Podcast. We know that the fall is here. You still got a couple weeks of summer, but hopefully that you had a little bit of a taste of everything that we need going into laser season. And maybe we'll see you next Tuesday, just feeling a little bit more empowered. Thanks. Bye.
Bye, everyone.